Now she desires oranges. This was very specific for this child. The appetite was good, the thirst was average, stools were normal, history of burning urination, and perspiration poor and chilly. Once in a while, she also had this burning urination. This was said by her. Now, there is a rubric in repertory: female vaginal discharge leukorrhea, girls in little. 26 medicines are mentioned for leukorrhea in young girls. Okay. And there are so many medicines. Merck and CPR are given in prominence, first grade remedies. And there are second grade remedies, Sina, Pulsatilla, and many others. But the medicine selection here was of medorinum. Medorinum, single dose. Medorinum is also present there. In third grade, however, it is present. But medorinum was given to this child, a single dose. And after that, she never complained of any of the vaginal discharge. The mother is also my patient. Now, this is the sixth case is of endometriosis and adenomyosis. Now, this is a 22-year unmarried lady presented with the following complaints. She had severe painful menses, and the important symptom was she used to get hospitalized every time she got periods since last 2 years. So this was her condition. She was very, very irritated because of this hospitalizations thing. And she said that since last 2 years, every time she got periods for 24 hours or to 48 hours, she had to be hospitalized. She stayed in the hospital. She got that drip, the painkillers through drip, and then she was discharged. And again, the next period, same thing repeated. So the ultrasound showed early adenomyotic changes and bilateral polycystic ovaries. These were the ultrasonographic report. Then she had history of typhoid, TB in grandmother, and fibroid in mother. Now the physical generals were there. She likes spicy food, fast food, and thirst was good. Stools incomplete sensation and occasionally constipated. She was chilly and otherwise everything was normal. This is the reports where you can see the changes. Now, female, now the rubrics that I had taken for this case: female pain uterus, menses during, and beginning of at. Now, another rubric is there: cry out compels her to during. You can see colocynth is present, pulsatilla is present in bold, and there is also nux vomica present. So this girl, she was working in an MNC in Gurgaon, and she was very, very ambitious girl. And every time she had a talk with me, I felt that she was a very highly ambitious young girl. So this rubric I had taken, mind ambitious, and on the basis of that, nux vomica was prescribed to her along with viburnum, which I said that she has to take viburnum every time she gets periods. Otherwise, I gave her a single dose of nux vomica. So she got periods, and she called me and she said this is the first time in 2 years that she was not admitted to the hospital. She had pain, but she could manage it at home and she was not admitted. Okay, Jonosia Asoka Q also I prescribed her for about 1 month, and viburnum she takes every time. Now this girl is in Australia presently, and she has the medicines with her, and every time she has periods, she takes viburnum. And nux vomica also I have given her once, and I think twice recently also I prescribed her again. I asked her to go for an ultrasound again, but she said, oh, she's in Australia, so she'll come back to India and then she will go for an ultrasound. So I have this initial ultrasound, but presently I don't have the later ultrasound. Now, this is a case of seventh case. I have 10 cases. Then quickly I will complete with all my cases. Now, this is a case of dysmenorrhea. She's a young 19 years unmarried lady with severe dysmenorrhea associated with vomiting. Now, this girl, she used to vomit with along with dysmenorrhea. This was her main symptom. So irregular menses and extreme pain and vomiting from excessive pain. This was her main symptom. Now I took the rubric in the repertory: stomach vomiting pains from colocynth is present. There are 6 remedies and colocynth is present. So colocynth was prescribed, and not only her periods became regular, but this dysmenorrhea was also taken care of with this colocynth. Okay. Now this is 8th case. This is a case of gestational hypertension. This is a lady, 37 years lady, consulted online for gestational hypertension with swelling of face, feet, hands, and fingers. And in her 6th month of pregnancy, with a BP of 190 to 110 mm of Hg with a slight or mild proteinuria. Now, she suffered with hemorrhoids also, which aggravated during pregnancy. And these were all the physical generals. Now, on the basis of swelling face pregnancy during, this was the rubric that I first took. And there are just 3 medicines given: Epis, Mercor, and Phosphorus. Now, on the basis of this rubric, I prescribed her Epis 30 twice daily for 5 days. And after that, after the first dose only, her BP came down, and eventually the swelling of the face also reduced. So Epis was prescribed on and off. She was given Epis, and later a single dose of Natramune was also given. And she delivered her healthy baby through C-section on the 5th October. Okay, so this was a case of gestational hypertension. Now, hyperemesis gravidarum. This is a 26 years lady consulted for gestational. This is a 26 years lady consultant. I could not correct this. With excessive vomiting she had during pregnancy. Okay, this is a case of vomiting during pregnancy. So we see 86 medicines are given for vomiting during pregnancy. Asarum, creosote, sepia, and symphoricarpus are present in bold here, along with all other remedies. So on the basis of this, symphoricarpus was prescribed. She was also given a dose of sepia, I remember, and then symphoricarpus was given, after which her this excessive vomiting that she had was controlled. She had vomiting. Usually we have vomiting just up till the 3 months. In the first trimester we have vomiting, but she continued to have her vomiting up till the 5th month. But it was very, very mild. She came to me around her 3rd month. Okay, so this was a case of hyperemesis gravidarum. Now this is another case of oligohydramnios. A 34 years lady consulted online for oligohydramnios with very much reduced fetal movements. This was the subjective symptoms, that she felt the fetal movements were very reduced, along with this report for oligohydramnios. She was worried that the movements were very, very reduced. Now, on the basis of the symptom that there is reduced fetal movements, I prescribed sepia 1m to her twice in a week. And after every dose, she felt an increase in the fetal movements, and her overall mental state also improved. Now, in such cases, you have to also recommend a very healthy diet to these patients, because usually it is also associated with hypoglycemia. These sometimes they don't feel like eating, they don't eat well. So these states trigger this reduced fetal movements, and especially if it is associated with circulatory defects, then you have to think of the medicines very quickly. And you also have to be in touch with the gynecologist also. You have to ask them to please go and have regular checkups, because you cannot take risk in such cases. These are when usually in the later months, okay, in the third trimester only such cases come to us. So uh, these cases you don't have to take risk all alone. You have to be in touch with the gynecologist. You have to always encourage them to go and seek help from them also, and you have to support them with your medicines. So CPR worked very well for her, and she consulted me just 10 days or 12 days before. She consulted me on the 10th of December, and twice I prescribed her CPR, and on 20th of December she delivered a healthy baby through C-section. Now we cannot claim in such cases also, except to just provide relief to patients, because patient satisfaction is very important for us. Is the only thing that matters for us. Whether or not they uh, give credit to our medicine or not, then nevertheless we have to prescribe, and we have to have that uh, you know that unconditional support we have to provide them. So this is a case of oligohydramnios. Then the last case is of insomnia and pregnancy. This is a 32 years lady. In her fourth month of pregnancy, she consulted for nightmares, for anxiety, and for insomnia. She could not sleep well, and the family didn't wanted to take the allopathic medicines, and also most of them are contraindicated during pregnancy. So she was consulted to me, and she used to wake up with all those bad dreams and nightmares, and then she could not sleep again due to fears. So she was prescribed belladonna multiple times, and relieving every time her anxiety, and her sleep also improved over the time. And recently she has also delivered a healthy baby girl. So this is a case of insomnia and pregnancy. So these are all the cases. I have just summarized all my cases. 11 cases I have shown here, and these are summarized. Now there is an important, I'll just conclude my this thing presentation with a role of diet is also very very important, especially in cases of pregnancy, where you have to ask them that you have to have a very very good healthy diet, not just supporting your general health but also your overall hormonal health. Okay, so this should be the the advices given to the patients by us. Dr. Hahnemann has also emphasized the role of diet and regimen. Okay, so the final takeaway of this is that hormonal imbalances are very very common these days. Gynecological disorders are very very common these days, with all the lifestyle factors also playing an important role. But still homeopathy has a very very important role to play, and we can support these patients through homeopathy in a very beautiful way. And we are living in a world where so much chemicals and so many the food and the beverage industries, every time we are ordering online we are getting hot food in plastic containers, we are drinking water in plastic bottles. So we have so much chemicals and microplastics inside our body, so many chemicals which are endocrine disrupting chemicals, EDCs they are classified as, because they are disrupting our hormones and they are causing fertility issues and whatnot, a lot of health issues. So these can also act as obstacles to cure. Dr. Hahnemann has asked us as physicians to also take care of the obstacles to cure. We should know them, because unless we know and mark them, we won't be able to treat our cases well. So this is also important, that these chemicals they sometimes act as obstacles to cure. Also cosmetics, deodorants, perfumes, and even soaps. Recently I saw that this Dove So they were, I'm taking this name of the brand because they are so cunning that they are putting those chemicals in European countries, they are banned, and but in India we don't have so many rules, and they just keep on selling their products in the names of fragrances, and we buy them because of the fragrances, that they have very good fragrances, and they are laden with all these endocrine disrupting chemicals, causing so much hormonal imbalance in us and also hampering our fertilities. So we have to take care that, especially in the sensitive times, especially in around the puberty or during pregnancies, we have to avoid cosmetics, we have to avoid deodorants, we have to avoid perfumes, because there is no marking, also there is no labeling. You don't know what ingredient is present in a perfume. We don't know what ingredients are present in cosmetics. Many cheap cosmetics, they have heavy metals in them. So we are supposed to warn our patients regarding all these things also, because we are preservers of health also. Dr. Hahnemann has said in aphorism 4 that along with all the knowledge the physician should have, he or she should also be a preserver of health. So we have to warn all our patients regarding all these disrupting chemicals as well. Then we have to educate them about nutrition, about healthy lifestyle and everything. This is also our role to play as educators. Then individualized, obviously homeopathy believes in a customized and an individualized treatment. We cannot have protocols that this and this medicine is going to work. Of course we can have strategies and we can have therapeutics, but finally individualized treatment is going to work for every case. So this is it, and homeopathy is indeed a blessing. It helps to manage a lot of physical and emotional complaints without causing any adverse effects. So this is the ultimate takeaway. This is the references that I have taken. You can go through the references. And thank you so much for the opportunity yet again. And that's it.
Thank you, madam. Thank you so much. Thank you.
Hello.
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 Thank you for the session, madam.
I'm not able to hear you, madam.